Hello everyone. Talking to you today about Chapter 9. We are in the 5th week of this online class, and Chapter 9 is on deafness and hearing loss, which, as far as percentages, probably isn't one of the one of the higher ones as far as categories of special education, but it's definitely one that you need to be aware of and aware of where you go for some assistance. So anyway, let's go on. The first thing I want you to do is definitely pull out the PowerPoint. And so go ahead and go to Blackboard if you haven't. Go ahead and go to the Chapter 9 under Course Documents, and you will find my notes to Chapter 9. You'll also see the module for Chapter 5, talks about Chapter 9, the PowerPoint slides. There is a discussion board, excuse me, and then, of course, this video. You'll have the AT assignment, and realize it's not for strategies this time, it's for resources, so make sure you look at that. And then take the Chapter 9 quiz, and then depending on the session you're in, you may have lesson plan due at the end of the week too, so look at your notes and see if that is the case. So anyway, you should be hopefully now with PowerPoint. One of the first things you're going to do is turn me off and watch the YouTube video for a family torn between deaf and hearing worlds. This first one is about 10 minutes long, so but definitely well worth looking into this and getting a better understanding of what the deaf culture is all about. So go ahead and pause me and look at the family torn between deaf and hearing worlds. All right, well, probably by now you have a real good understanding of some of the differences and some of the things that you may have to run into when you're working with students and families that are deaf. And as you read the book, I hope you'll get a much better understanding of the deaf culture. Some of the chapter objectives is state what distinguishes a child who is deaf from a child who is hard of hearing in terms of the primary mode used for learning and communication. This is where the differences come about. Describe how deafness and hearing loss affects a child's acquisition and use of speech and language, academic achievement, and social functioning, along with identify the estimated prevalence of children who are deaf or hard of hearing, and describing basic types of hearing loss, common causes of each, and how the age of onset affects a child's education and learning needs. A couple others, we have 2 more slides on chapter objectives. Describe the information provided by an audiogram. Identify technologies and supports used by students who are deaf and hard of hearing to amplify, supplement, or replace the sound. There will actually be a video later on in this that you will definitely be able to see that and have a better understanding of that. Compare and contrast the underlying philosophies, methods, and key components of oral, total communication, and bilingual, bicultural approaches to educating children who are deaf and hard of hearing. And finally, you'll be able to briefly explain how placement can influence quality-related services, access to language and curriculum content, and social opportunities and cultural identity for a student who is deaf. So those are the main objectives that I do want you to learn through these slides and this text. Definitions. Deafness is a hearing loss that is so severe that the child has difficulty processing linguistic information through hearing with or without amplification that adversely affects educational performance. A hearing loss means a loss in hearing that adversely affects educational performance, but is not included under the definition of deafness. And then the other definitions, you have deaf. These students use vision as a primary sensory mode of learning and communication. Where hard of hearing, these children use their hearing to understand speech. So the primary difference is if you're deaf, you're not going to be able to use your hearing. You're going to be using vision as your sensory mode for learning and communication, whereas hard of hearing, these children will still use the hearing to understand speech with the help of a hearing aid. Many persons who are deaf do not view hearing loss as a disability. And I think that's probably what if you watched all the 10 minutes, and hopefully you did, because that will gain you a lot of information that will help you through the rest of this chapter and help you with some of the questions. But the deaf culture definitely comes out in that video. What distinguishes a child who is deaf? Again, just a little different rendition, but the same thing. Children who are deaf may be able to perceive some sound, but are unable to use their hearing to understand speech. So they may be able to hear, but it's not going to be able to hear well enough to understand what that speech is all about. They also develop speech and language skills mainly through their sense of sight. Children who are hard of hearing, on the other hand, still use their hearing as a primary modes of that auditory stimuli there. DESE definition, hearing impairment and deafness definition. Hearing impairment means an impairment in hearing, whether permanent or fluctuating, that adversely affects child's educational performance, but is not included in the following definition for deafness. Deafness means a hearing impairment that is so severe that a child is impaired in processing linguistic information through hearing, with or without amplification, that adversely affects a child's educational performance. Again, you're getting an understanding, all of it affects a child's educational performance. Criteria for initial determination of eligibility. A child displays a hearing impairment or deafness when either a hearing impairment has been diagnosed by an audiologist and the hearing impairment adversely affects the child's educational performance. Here's a little bit more of how we hear. Audition is complex and not completely understood process, and it goes through the process of how we hear. The outer ear, external ear, and the auditory canal. I'm going to let you read through some of this a little bit. You all are college students. I want to get to some of the more interesting and pieces that I want you to get a hold of. You do need to know what a decibel is, what 0 dB represents. The sounds 125 dBs or louder cause pain. You do need to know what the definition of hertz is, and the frequencies will help you better understand this area. Characteristics, definitely need to realize students who receive special education because of hearing loss are a heterogeneous group. Levels of functioning are influenced by the type and degree of hearing loss, the age of onset, attitudes of the child's family, opportunities to acquire the first language, and then the presence or absence of other disabilities. Generalizations about how deaf people are supposed to act and feel must be viewed with extreme caution. And I hope that you will gain that by the end of this session. Students with hearing loss have smaller vocabularies than their peers with normal hearing, and the gap widens with age. So, as you may not notice as much when you're in the elementary years, but if you are teaching a student who is deaf and you are in the middle school to high school realm or college, then you're going to see a lot more of the vocabulary differences there. They learn concrete words more easily than abstract words. They have difficulty with function words and omit the endings of words. They have difficulty differentiating questions from statements. If you think about that, many times how you hear it is how you know if it's a question or not, or if it's a statement. Well, these students have difficulty hearing, whether it's a hearing loss or deafness. They're going to have a difficulty understanding whether it's a question or not. Have difficulty understanding and writing sentences with passive voice and relative clauses. Academic achievement. Atypical speech is common in many children who are deaf or hard of hearing. Students with hearing loss have difficulty with all areas of academic achievement, especially reading and math. The gap in achievement between children of normal hearing and those with hearing loss usually widens as they get older, very similar to the vocabulary, which I'd assume is kind of linked to that. Problems attributable to inadequate development of first language and the mismatch between the demands of spoken and written English and the student's ability to understand and communicate in English is also apparent there. Social functioning. Behavioral difficulties in school and social situations are more likely with children with hearing loss than children with normal hearing. Reports of feelings of depression, withdrawal, and isolated frequency reported by children and adults who are deaf and adventitious hearing loss. Poor readers are more likely to exhibit problem behavior in school to one study also. So remember that. You'll need to see that whenever you're talking and looking at the quizzes. The extent to which a child with hearing loss successfully interacts with depends on others' attitudes and the child's ability to communicate in some mutually acceptable way. So that you need to kind of understand that part too of social functioning. I want you to, here's a spot, I want you to go ahead and read the question and then give your best guess at what it might be, and then we will talk about the answer. So go ahead and stop the video. Write down, how might deafness affect a child's acquisition and use of speech and language, overall academic function, academic achievement, and social functioning. So if you will go ahead and look at that, and then you can pause me and I'll look at the next one. You have a couple in a row. As discussed earlier, a disability may be a handicap in one environment but not in another. Many children with hearing impairments and deafness lag behind their hearing peers in academic achievement, and the gap of achievement normally widens as they get older. This suggests that more effort needs to be made to enhance the curriculum and instructions for students with hearing impairments. Conversely, when answering this question in regard to language and social functioning, it may be helpful to consider another question. Is it nature that attaches enormous importance to hearing in human development and learning, or is it society? So let's stop the video and see what your thoughts are on this one. Well, most people live in a world where hearing is vital to virtually every aspect of their lives. Yet there exists a deaf culture that insists it's not a disability to be hearing impaired. To me, it's very much like somebody that speaks Spanish may not think that that's a disability because it's just another language. And to the deaf culture, sign language is another language. It's kind of how I take the perceptions of that. In that community, what appears to be a handicap is not. And given a supportive environment with listeners who can understand the mode of communication, most deaf and hard of hearing children function quite well. Some of the prevalence, a large majority of persons with hearing loss are 65 years of older. Well, that pretty much takes them out of the elementary setting. Males are more likely than females to experience hearing loss. During the 2012-2013 school year, about 77,000 students ages 6 to 21 received special education services under the disability category of hearing impairment. This represents 1.2% of all school-age students who receive special ed services and about 0.1% of the student population. So again, you're not going to see as many I can see 3 students is what I have seen through my education. 2 of them in K through 12 and 1 of them in a college setting. So probably not going to be the one that you'll remember. So it's going to be one that hopefully these videos will help you remember some things a little bit longer. So, and the biggest benefit would be resources that you can get help with. Many times there's going to be extra resources that you can gain, other agency involvement you can gain with these students. How does the prevalence of hearing loss in school-age children compare to that of older segments of the population? We just talked about that. I want you now, this is the same family, but a little different take on the cochlear implant and deaf culture than the beginning. It's a little bit less. It's only about 3.5 to 4 minutes. So go ahead and pause me and get a little bit more information about the deaf culture with sign language. All right. I think you probably got a little bit more of an idea from that. I'm hoping it's kind of getting your emotions going one way or the other. This will definitely help the discussion board posting. Got another question for you to write down and then answer a little question. What implications for a child's education result from the type of hearing loss and the age of onset? So if you'll pause the video, give your ideas, and then come back and I'll give you the answer. In general, the time of onset and the severity of hearing loss greatly affects the child's education. Prelingually deaf children's education normally focuses on the acquisition of language and communication. A child who has suffered a postlingually hearing loss usually focuses on maintenance of intelligible speech and appropriate language patterns. In other words, those that heard early on and had their use of their hearing early on, can use some of that language already learned and hopefully build that a little bit, whereas those that had no hearing at all would not have that advantage of having any part of communication through speech at that point in time. Prevalence, a national survey indicated about 39% of deaf or hard of hearing students had severe or profound hearing loss, and about 40% had another disabling condition. So I'm not sure where the other 20% went to, but anyway. So while there may be some that are categorized under deaf or hard of hearing, there are pretty much close to half that may have another condition that they may be under in regards to their IEP and the category that they're being served. So that's where the prevalence comes in a little bit differently there. Some of the types: there's conductive hearing impairment, which results from the abnormalities or complications of the outer or middle ear. There's sensory neural hearing impairment that entails damage to the cochlea or involves abnormality or failure of the auditory pathway, which might include mixed hearing impairment, which is a combination of conductive, sensory, and neural hearing loss. There's also unilateral and bilateral hearing loss, acquired and congenital, and prelingual, postlingual types. Some of the causes: there might be genetic factors involved. Maternal rubella, congenital cytomegalovirus, prematurity, causes of acquired hearing loss, like otis media, meningitis, Meniere's disease, or noise exposure. I do wear hearing aids, but it's probably mostly to noise exposure with a little bit of genetic factors built into. My father and grandfather both had hearing loss over time. So, causes may be a little different, and that'll affect the amount of education, the amount of communication, the modes of communication. Vocabulary is included in there too. Identification and assessment. The Joint Committee on Infant Hearing recommend that all infants be screened at 1 month of age. There's the auditory brainstem response and the autoacoustic emission screening. Pure tone audiometry, which is assessed using an audiometer, that you'll learn more in the book. Speech reception test, along with alternative audiometric techniques, play audiometry, operant conditioning, and behavior observation audiometry. So then we have technologies and support. You have hearing aids, digital programmable hearing aids, and they're making more and more, technology is getting better and better. The earlier in life a child is fitted, the more likely he will be able to use the hearing to help him in education. Group assistive listening devices, a radio link established between the teacher and the child with hearing loss. You'll actually get to see this in one of the videos here in a little bit, and should give you a definite idea of what that might be. Cochlear implant bypasses damaged hair cells and stimulates the auditory nerve directly. Controversy surrounds cochlear implants in the deaf community, which you've heard now 2 different videos about those cochlear implants. Sign language interpreters, signing the speech of a teacher or other speaker for a person who is deaf. You probably have seen this at different times, whether it be on TV or maybe at a big event that you might have had. They might have had that there. Speech to text translation, a computer device that translates that speech to text. Television, video, and movie captioning, printed text that appears at the bottom of the screen. And text telephones allows the user to send a typed message over telephone lines to anyone who has a teletype. And there's other computer technology and alerting devices that go along with that. I know as a teacher, one of the students that I had used interpreters, and you do have to make sure that you are taking that into consideration. You do need to take a little more pauses to let the interpreter and the student that is using them, or the adult that's using them, be able to ask questions, because it does take a little time to get, after your speech is over, for the interpreter to go ahead and let you know, if they have any questions. Also, it's a good idea to, after it's over, to let some time be open in the class, so that you can talk to the interpreter and the student directly, to just verify that they do understand. Again, there may be some terms that you use that he or she is not aware of, and so by putting this time in there and work it in, you can make sure that you are communicating well and that student can still continue to learn in your class. Here's another question. In what ways do students who are deaf or hard of hearing use technologies and support that amplify, supplement, or replace sound? So kind of write down what your thoughts are. We just talked about a few, so it should be pretty easy. And then come back and let's see how you did. Depending on the severity of the hearing loss, the student may have a hearing aid placed in one or both ears, able to amplify those ambient sounds. These same children may also use speech-to-text computer program to help supplement their hearing aid in large group sessions. They may also employ a sign language interpreter in another situation where appropriate. One thing that you need to understand too, when they are using a hearing aid in classes where there's a lot of noise going on, it may be a lot more difficult for that student with a hearing aid to really listen to what you have to do. So you need to make sure and be aware of, in a large environment, any noise that might make it difficult for them to hear you because of all the noise in the classroom. They can't distinguish directly maybe what you're saying from somebody else. Hearing loss in the classroom, this is where I have another video that will give you an idea of the amplification process when a student is hooked up to basically a speaker and helps the teacher. So go ahead and pause me and go ahead and listen to the hearing loss in the classroom video. Okay, hopefully you got some good ideas from that. The next one is educational approaches. You got oral and oral approaches, auditory learning, speech reading, and cued speech. You also have total communication, manually coded English, finger spelling, and then you have American Sign Language, or ASL. ASL is the language of the deaf culture in the USA and Canada. There's a bilingual, bicultural approach. And which approach for whom? Well, look over those. I want you to do a little more information on cued speech and get a better idea of how that works, so that you'll have an idea of how you might be able to help your student. I have a next slide on how do oral and oral communication and bilingual, bicultural approaches to teaching students who are deaf differ in their philosophies and methods. For many years, educators have debated the most appropriate instruction methods for these children. Educational programs with oral emphasis view speech as essential for integration into the hearing world. Much attention is given to amplification, auditory training, speech reading, and the use of technological aids. Other educators emphasize a total communication approach with students with impaired hearing. This approach uses a variety of methods to assist the child in expressing, receiving, and developing language. Still others believe that deafness merely reflects a linguistic difference, not a disability, and therefore advocate for the exclusive use of ASL as the method of instruction. So definitely not a decision that those with hearing probably have a good understanding or good thinking of how to work with. Definitely one that families are going to probably be stressing over and having problems with for many years to come. Placement options. The majority of children who are deaf or hard of hearing attend local public schools. 54% receive most of their education in regular education classroom with hearing students. 17% attend resource rooms for part of the school day, while 16% are served in separate classrooms. Only 4% attend residential schools for the deaf. About 40% of all students with hearing loss go to college education. So think about that too. Many of the students that you will have, almost half of them will go to college at some point. So something to remember. How might a student's and his family's perspective and wishes regarding educational placement be influenced by their membership in a deaf culture? What do you think about that? You've seen a bunch of different videos that help you hopefully understand the deaf culture, and you hopefully have read the text or are getting ready to read the text. So give your ideas. What do you think about the deaf culture? And then turn the video back on and we'll hear the end of the story here. Well, hearing impairments are usually viewed as one of the more significant disabilities, perhaps because so much of our learning comes to us through the sense of hearing. Yet many people with hearing impairments or who are deaf view hearing loss as not a disability but a linguistic difference. In addition, most people who are hearing impaired have typical cognitive abilities and can often do vociferous advocate for their own rights. For children who are born to parents who are deaf, participation and affiliation with people who share the same mode of communication may be extremely important. So, just some food for thought on that one there. And there is the PowerPoint. I do want to add, for those that are continuing with listening to me on this will be an advantage to you. If you will go back to the week 5 section and scroll all the way down to the bottom. I've had this asked many times and I've never been able to find it, and I was able to find it today. What happened to Heather? Did she get the cochlear implants or not? And find out what she is doing today. And this is as of May 18th of last year. So when you get done with this video, if I've piqued your interest to see what happened to Heather, there is an article that I have at the bottom of the Chapter 9 folder, or in the Week 5 folder there, that says what happened to Heather. If you will click that, you will get to see the PDF document and an article about what happened to Heather. Some of the next things before you leave, make sure you look at the assignments that are due this week. You will have a couple there. And if you have questions, as always, get with me. By now, I've met with many of the students with their 20 to 30 minute conversation about the observation report. It is very critical that you get with me and set up this time. If not, I've had many students that do not do this 20 to 30 minute time that end up having to redo much of their 300-point observation, or they don't get the grade they would like to have with their 300-point observation. So please make sure and get with me and set that up. By now, you should be getting some ideas from Mr. Runyon's office on how your observation placement might be if you are local. If you are not local by now, you should be emailing me where your sites should be. And to clarify, you have to have 3 hours of observation in the regular classroom. That's with a regular education teacher, with regular education students, with a few special education students in the classroom, and you will also have 3 hours of special education observation that must be done in a special education classroom with all special education students with a special education teacher. It can't be a student teacher. So anyway, that should get you there. You should have your background check done by now. If not, email me ASAP. If for some reason you don't have your background check completed, that should be done by now, and on that. So your DI collection, last week, I'm going to give a little more update there. Last week with ID, you should have started looking on Pinterest. We are not utilizing any of the other technology aids. We are only using Pinterest for this semester. So create a Pinterest account, create a board called DI Collection or something similar, and share that board with me. My username is MC Brunk. If you're having trouble sharing that with me, please let me know. please also let me know if you shared it with me, and that way I can start watching and seeing how you're doing. But each week in each of the chapters from here on out, you should be looking for at least 5 or 6 Pinterest items that are related to the DI collection section. That means that you're going to be looking for sample lesson plans. I would suggest you relate it to your own area. That way it becomes a little more usable for you. And then explanations of differentiated instruction strategies is another section that you will have to have. And then websites. You can utilize some of the Pinterest items that are actually websites that are about differentiated instruction. And if you find a website that is really, really good, then pin it to your board and use it as a website. Anyway, and if you have questions on the DI collection, I would definitely email me this week so that you don't get too far behind. And most of you, if I've talked to you about your observation report, I've also had a few minutes to spare. I've went ahead and talked to you about the DI assignment also. So anyway, go ahead. You will have the chapter assignment on resources. It's assistive technology resources that you will do for this chapter also. You need to list 20 assistive technology and supportive resources that would help you those with a hearing impairment. Some can be taken from the textbooks, while others can be taken from the internet. So anyway, you all have a great week. And I think most of you by now are doing a lot better in the class. You figured out how I do the quizzes and what you need to have for your discussion board. So keep it up. As always, ask me if you need help. Talk to you later.